The Nigerian government has raised the retirement age for healthcare workers to 65 years, while consultants can now work until 70 years. Officials say the move is part of broader efforts to address a critical shortage of healthcare professionals caused largely by the mass exodus of workers seeking better opportunities abroad. However, while many experts have welcomed the decision, some believe it's not addressing the root of the crisis. Our correspondent Ajak Mangut reports.
Kingsley Osage, a veteran pulmonologist at this Abuja hospital, says he's thrilled to have the opportunity to care for patients for a few more years.
I'm very, very much excited that the government has decided to increase retirement age for health workers from 60 to 65 years, and that of the consultants to 17 years. And because you know that to train a consultant, for instance, you will need a minimum of 20 years from medical school to become a specialist. And that's the minimum. A lot of us spend 25 years. And so if you still insist on the 60 years retirement age, the individual may end up spending 15 years, maybe those that are very lucky, 20 years in service. And that, will, in my view, will be a disservice to the nation.
A mass exodus of workers has left a shortage of personnel in an already struggling healthcare system. Last year, authorities said the country had an estimated 300,000 health professionals, including doctors, pharmacists, nurses, and midwives, catering to a population of over 200 million people. But many of these are not happy in their employment.
Poor pay, welfare, inadequate working tools, and a weak economy has led hundreds to seek better opportunities in countries such as Canada, the UK, and US in the last few years.
To alleviate the situation, the Nigerian government is now bumping up the compulsory retirement age to 65, allowing more experienced healthcare workers to remain in their positions. At the same time, they can provide much-needed training to new personnel. But some medical experts say such a measure is just a stopgap and say the government is failing to address the root cause of the crisis. What exactly is pushing so many qualified people to leave their homeland?
Increasing retirement age is not the issue. It is a social welfare package that goes alongside with it. We need to harness all by fixing the economy to guarantee, a friendly environment, work environment for our professionals who have received proper training so that they can service the economy.
The government says it's working on other initiatives. For instance, it increased the annual enrollment for medical, nursing, and other health-related courses from 28,000 to 64,000. Last year, it also introduced the National Health Workforce Migration Policy, designed to improve training, create better career opportunities and welfare for healthcare workers, and offer incentives such as grants to encourage those who have left the country to return. That could be vital in retaining professionals like Kingsley and curbing the trend of medical brain drain. Ajak Mangut, CGTN, Abuja.